As hard as we work, however, setbacks in life happen, both personally and professionally. That will challenge us to the core of our being. And this leads me to my fourth and final piece of advice, and that is make your response to setbacks count. Because trust me, you all experience setbacks. My first child, Sarah, was born severely and multiply handicapped, and it was a challenge to my wife and I to the core of our being. It really was tough. Our first child, we were very young, in our early 20s. And in fact, that was Sarah who we were taking off across country to my fellowship at the Mason Clinic, Virginia Mason Hospital. And a physician friend of mine who had gotten to know at Mayo had a son born about the same time with very similar disabilities. And he and his wife had decided not to have any more children for fear of having another handicapped child. And although Vita and I certainly understood their concern, we just decided that we were going to have more children. In fact, we had 5 more. And Sarah lived at home with us for 23 years. She required help with all activities of daily living, feeding, dressing, toileting, and all 5 of her younger siblings got to participate in helping her. And Sarah accompanied us in all family vacations, outings, and all activities. And interestingly enough, all 5 of her siblings today are what I would call very successful in life. But the interesting part is that all 5 of our other children will say that a large part of their success is due to the influence that Sarah had on their life. So I think how you respond to a challenging situation or setback can make all the difference on your life and on the lives of those around you. And in your career, you're going to experience setbacks, trust me. There's going to be times where you're not going to get the promotion that you felt you deserved. There's going to be times where you didn't get the salary increase that you thought was justified. And you have a choice to make. You can either feel sorry for yourself and be bitter, or you can suit up, show up, and do the next right thing. I think a good example of this might be when I took my first CEO job at Mercy in 1989. 2 weeks into the job, I found out from the CFO that we didn't have enough cash to meet payroll. And you may ask why I took a CEO job in an organization that had so much financial stress. Well, the fact is I was young and accepted when the board told me they wouldn't share the financials until quite a bit later into the process, until it was too far along where I'd already announced to the organization where I was at that I was leaving to turn back. So I had to borrow cash from a local bank in order to meet the second payroll. And then I went to work on trying to get a bond issue formed and realized that we had junk bond status on the condition of the hospital. And so I had to convince an insurance company to insure our bonds so we could even get what was called junk bonds, BBB minus. But I needed this money to start, turning the hospital around. The hospital census had declined for 8 straight years. Mercy had lost market share in 28 out of 35 zip codes. Not a single physician had been added to the medical staff in 4 years, and the outpatient visits were decreasing. But worst of all, the community had the perception that if you were sick at all, of anything serious, you needed to go to Madison 40 miles away for care. So what did I do? I guess I could have bought my time and tried to look for another job opportunity, but instead I started working 14 to 16 hours a day, and I did this for 5 years to turn the organization around. Instead of laying off staff to save money, I began to build this integrated system dream that I had in my mind. I used the $9 million to recruit specialists and subspecialists to create regional centers of excellence in order to create a halo effect so we could change the perception of the community of the level of care that Mercy was able to provide. And then I began developing a network of family physicians, even started a family practice residency program that's not through a university. It's still the only one in Wisconsin today where we're get our own CMS funding to create and to manufacture our own family physicians to put out into the clinics. And so, this really got us off to a great start. I will say that in '89 to '94, along with traumatizing my medical staff with the ICU, those types of decisions, if any of you look back, it was very controversial for community hospitals to employ physicians, especially specialists. And so after a series of lawsuits against me personally, it played out on Madison television, death threats against me, and firebombing of our family practice residency building. We got through that. And in 1994, 5 years out of nowhere, the American Hospital Association had named Mercy a great comeback organization because of the miraculous transformation and newfound financial soundness. And as the CEO, they put my picture on the cover of Hospitals magazine. So that year I was feeling pretty good, and I went in for my board review, a compensation review, and the board proceeded to reprimand me for the national recognition. The board said they were insulted that Mercy was a great comeback organization because in their opinion Mercy didn't need to come back from anywhere, and it was a bad reflection on them. And it was really driven, I think, by one individual who had been calling the shots, who thought he knew as much about healthcare as he did his own industry, who was able to whip that attitude up by the board. But nevertheless, they documented my reprimand and added the paperwork to my employee file. Here I'd moved the organization from a gross revenue of $33 million, not being able to make payroll, to over $233 million, built a network of new specialty programs, a network of family practice and primary care referral centers, had greatly grown the patient volume and experiencing real financial success, and I was being reprimanded. So the compensation committee consultant who was at the meeting called me later and he said, "Wow, I just can't believe how you handled it." He said, "If I'd been in your position, I would have told them to blink themselves and the horses they rode in on." This guy happened to be from Kansas, if you want to know where the analogy. But the point is this: if I reacted to how I wanted to react at the time, it certainly would have felt good to tell them where to go. But Mercy would most likely not be in the position it is now, and that is a highly vertically integrated health system with 69 facilities in 2 states and a wholly owned and operated insurance company with fantastic physicians, hundreds of multi-specialty physicians that are very much a part of the system. And our gross revenues have grown from $33 million to over $1.2 billion. That's before the Rockford merger. We were ranked as the 11th most vertically integrated health system in the country, and we're also ranked as the fastest growing health system for same-store growth. That's growing from within ourselves, not as a result of mergers and acquisitions. After doing this Rockford merger just since January, I probably should have started that process a lot earlier, because it's a lot easier to grow by $1 billion by bringing in another system than it is to develop $1 billion of organic growth. So that's something to be said for that. But obviously Mercy had to come back from somewhere, and it was in dire straits, and I needed to remember, though, at the time of the board review, that I had a vision, a comprehensive integrated health system that I believe Mercy could be. And if I didn't remember this, I could have probably not kept my emotions under control, but the fact of the matter is I had to remember it was the long haul. And sometimes career setbacks happen, and you need to move forward and do the next right thing. I've heard it said, in fact, it was Father Daniel who said it to me. He said, most people can be a good administrator, they can be a good professor, they can be a good husband, a good wife, a good father, a good mother for 5 years. But the key is, can you maintain it for 45 years? Can you stand the test of time? Are you going to rise to the occasion and then flame out? Because it's the long haul that counts. Setbacks and challenges happen at all stages of our life. But the question is, do you get derailed and thrown into town when new challenges hit you, or do you press on and do the next right thing? Certainly, Vita and I could have thrown in the towel with Sarah and felt sorry for ourselves. I could have thrown in the towel with the board and justice, or numerous other times over the last 38 years. But to get through those rough patches, I just kept kind of waking up, suiting up, showing up, and doing the next right thing. And I guess I would say to young people, when I talk to young people today, you just can't always do what feels good and expect to achieve long-term success. You can't just always do what feels good to you and expect to achieve long-term success. And so this ties back into advice number 2, know yourself. To manage yourself, to be able to manage others. I've been married for 42 years, and I will say some people are more difficult to manage than others. I spent 25 to 30 years banging my head against the wall trying to figure out how to manage my wife. And after about 30 years, I finally figured out how to manage her. And that is, I manage her simply by doing everything she tells me to do. And then I've got her just where I want her, you know. No. But anyway, so, but I would just say that your response in times of adversity and times of setback is key to a successful life and career. So I'd like to conclude just real quick with my 4 points of advice. Choose a path, be specific, don't just wander through the healthcare options. Set your goals, big goals, in order to achieve great things. 2, know yourself. Learn how to manage your thoughts, feelings, and actions and emotions so that you can begin to embrace your flaws and you can work on them to improve and help you grow as a person, as a leader. Make big decisions with courage. When it seems too overwhelming, simply break it down and think, what's the next right thing to do? And lastly, number 4, make your response to setbacks count. Think positively and remember the long haul, your vision. Your future success and happiness depend on it. My work has always been more than a job to me. It's been a calling. It's given me great rewards. I want to thank you again for inviting me to share in your graduation luncheon. And I wish you all the very best. I look forward to reading and hearing about many of you in the future as you transform your dreams into reality. Thank you very much.